Hi, Dr. Pearl here, and we will be speaking with Dr. Lisa Fillis. She's a naturopathic doctor. She shares space with us here at Bixby Knolls Wellness Center, and we are going to talk to you today about gut health. That is our theme for the month of March. And what exactly are probiotics?
Oh, good question. Those are the bacteria that live in your gut. So we have about 10 trillion bacteria that live in our large intestine. Most of them are what we consider good bacteria. There's a little bit of bad, but that's kind of the good and the bad. So probiotics are those good bacteria. Lactobacillus, bifido, those are the big ones that we're using. There's a big, I don't know how far we want to get into this today, but there's a big conversation going on right now in the community about whether probiotics are good or not, or we actually want the metabolites. So the good bacteria that live in us, they eat our food and they give off serotonin, histamine, short-chain fatty acids. Those are the metabolites we're looking for. So the question is, do we want to be taking probiotics, or do we want to be taking the metabolites that come with it? But right now the standard is still probiotics are good because you're still getting those good metabolites as well.
That's super fascinating. I always explain to my patients, I'm like, think about your body like a neighborhood, like real estate.
Yeah.
If all of the real estate is taken up with good stuff or stuff that is harmless, there's really hard for the invasive stuff to come in. But if your neighborhood has all these different holes because you're eating a ton of processed foods, or maybe even in the case of people who have gastric bypass and stuff, it's harder for them to extrapolate and get those nutrients they need and good bacteria. But like, you will safeguard yourself if you keep your neighborhood full and all the real estate is full of good or neutral bacteria, because we have microorganisms living all over our bodies, our skin, our eyes, our mouth, every opening, everywhere, and it's actually not a scary thing, it's a good thing. We want good bacteria or neutral bacteria versus the harmful ones that make us sick.
Correct.